Hello everyone and welcome to the NPTEL course in Herbal Drug Technology. I, Galvina Pereira, Assistant Professor, Department of Pharmaceutical Sciences and Technology at Institute of Chemical Technology, Mumbai, will be taking you through the next 4 weeks of this course. We are learning herbal drug technology, and in this herbal drug technology, we are at week 5. This week I will take you through details of what are called as herbal interactions. Herbal interactions include herb-drug interactions, herb-food interactions and herb-herb interactions. So what are these herbal interactions? So as we know, most of the population, so as per the WHO reports, estimated amount of 80% of the global population relies on traditional remedies, majoritarily consisting of herbs for their medications. Now these medications sometimes are taken as prescribed by the practitioner, sometimes they are taken by self-medication. Now what happens is, when these herbs are taken by self-medication, many a times other herbs are co-administered. Similarly, with the evolving population migrating to cities, the lifestyle and the food is also changed. So what happens is, people take this herbal medications along with modern allopathic drugs, as well as people take this modern medications along with traditional herbs, as well as people take this along with food, as well as the combinations. So lot of this permutation combinations have been done, and definitely when such combinations are done, we need to check if they interact or do they have some common ground. So this particular week I will take you in the depth of what happens or how we understand herb interactions. So whenever you eat or whenever you consume a herbal medicine, what we are assessing here is basically the effect on our system. We call it as biological effect. So we consume herb to get some desired biological effect, and this biological effect can be beneficial to our health as well as beneficial to the general well-being. So some are just taken as nutraceuticals, some are taken as drugs, but in both cases they do interact. So take for example, we administer a herb or a herbal drug. Now we could administer any plant part. This includes your root, stem, leaf, which are the organized drugs, as well as we could consume the unorganized parts. That includes your gums, latexes, resins. Now this could be considered or consumed as a drug, or in some cases they are processed further to prepare extracts. These extracts also have been administered as drugs. Now many a time when you consume these drugs along with other medications, take for example modern day medications such as warfarin, or when you consume them with food which are rich in cheeses, amino acids, foods which are rich in fibers, the interactions happen. Not only that, when these herbs are co-administered with other herbal combinations, there also you observe the interactions. Now herbs is a basic component that I am discussing, but what happens in our biology is the compounds which are present in herb interact at a molecular level with the compounds present in all these 3 components, and as a result what happens is it affects the biology. Now this net biology may cause an increase or it may cause a decrease in the effect of the drug or of the herb. Now that's what is called as interactions. So herbal interactions are basically the difference in pharmacology that we observe after consuming this herb in combination either with a medication such as your allopathic medication or your allopathic medication, or your food or your homeopathic, Ayurvedic or any other herbal preparation. So how do they interact? So the types of interactions or types of herb food or herb drug interactions can basically be classified into two broad categories. The very first category is pharmacokinetic interactions. When I say pharmacokinetic interactions, I mean these herbs will affect the ADME. What is ADME? The absorption, distribution, metabolism as well as excretion of other drugs or the herb themselves. Alternatively, what can also happen is pharmacodynamic interaction. So, whenever you administer a herb or whenever you administer a drug, it is going to show you a biological effect. Now, this biological effect can be altered if this drug or herb is co-administered with another herb, food or drug. Now, here what is going to happen is the net effect, the net pharmacological effect or the net biological effect is going to change. Now, this biological effect may be enhanced or this biological effect can be depreciated. So, you can see all in all the effects of this interactions can be classified into following 5 categories. Either the pharmacodynamic effect can be additive, it can be synergistic, that means more than additive, it can be antagonistic, then that is opposite, it can lead to potentiation, that is more than enhanced effects, and in some cases you can even observe adverse or side effects of this combinations which are not beneficial to the human health. So, let us see few examples or few cases here. So, we will discuss first cases of pharmacokinetic interaction. We said that pharmacokinetic interactions occur when the drug or a herb that you consume alters the pharmacokinetic parameters such as absorption, distribution, metabolism or excretion. Say for example, you are consuming a diet or you are consuming black pepper. Now, black pepper or kali miri, which is often referred to, is an ingredient of numerous Ayurvedic preparations. Not only that, in modern day herbal drug technology, its bioactive compound piperine is also used. Now, piperine, the alkaloid which is present in your black pepper, is known for its bioenhancer properties. Now, what are bioenhancers? Bioenhancers are the molecules which when administered with drug will increase or enhance the bioavailability of this molecule. So, say for example, if you are consuming black pepper, which is included as a part of your Ayurvedic medicine, or in cases maybe a part of food such as your pastas. So, this black pepper will contribute some piperine into your blood, into your system, and this piperine will enhance the bioavailability of certain drugs such as phenytoin. In that case, we may observe that the additive effect or you will get a very enhanced effect of phenytoin. Similarly, what happens is there are certain drugs which can affect the distribution. Normally what happens is whenever you administer a drug via stomach, it goes into your bloodstream. We call that as your systemic circulation. Now, once it gets into your systemic circulation, it goes or travels to different organs. We call it as distribution. So, what happens is certain times there are drugs which will not distribute uniformly. Say for example, not every drug can cross the blood-brain barrier. Not every drug can have entry in all organs. So, this distribution is determined by different factors. Now, one such consideration or one such example is what we call it as protein binding. So, say for example, your drug has got absorbed from your stomach into your blood. Now, your blood has numerous proteins circulating. Many a times, majority of the drug candidates have been found to bind to these proteins. What is happening as a result of it is because they are bound to the proteins, they are kind of blocked. and they are not free flowing or free to go to the organs where the desired effect is there. So, they will keep on circulating in the blood bound to the plasma. So, this binding of drug to the plasma will keep the drug in circulation, but at the same time it will not let that drug move to the desired organ and bring out the desired effect. Say for example, a drug has a 90% plasma binding. So, what does that mean? If I give you 100 milligram of drug, 90 milligram will remain bound and only 10 milligram will be there in my blood to show the pharmacological effect. So, my pharmacological effect is just shown by 10 milligram of drug. Now, imagine you consume a drug such as garlic. Now, what is this garlic going to do? Garlic has some compounds which will displace this drug from plasma. So, what happens is initially 90% of the drug was plasma bound. Now, because garlic has displaced it, 50% is here which is in bound form, 50% is kicked out into your bloodstream. Now, what happens is, now when I am considering 100 milligram of my drug, initially just 10 milligram was there to show the pharmacological effect, and that is what your drug dose is calibrated for. But now that because we have consumed garlic in our diet, 50 milligram remains bound to plasma and 50 milligram is thrown into your blood. So, instead of 10, when 50 milligram goes into your blood, you are going to have a huge quantity of drug, and that will cause a enhanced pharmacological effect. Now, in certain cases, this pharmacological effect may not be desired. We don't want this extent of pharmacological effect, and that leads to toxicity. So, there are drugs which affect the distribution, which affect the transportation of the molecules as well. Now, we come to the third example, and that is metabolism. Now, the drugs that we consume cannot remain in our body forever. Say for example, you consume paracetamol. Paracetamol cannot remain in your body forever. Our body has mechanisms to kind of remove it from the system, and this is basically what we call it as your metabolic pathways. Now, metabolic pathways are good because they also help eliminate toxins, they also eliminate drug molecules from our body. Now, there are certain enzymes in our body which are responsible for metabolizing this drug. Now, what do this herb candidates do? So, when you are consuming herb candidates or herbal drugs, now the phytoconstituents which are present in this herbal drugs can lead to two things. Either they can increase these enzymes which are responsible for drug metabolism. Now, what happens is, if these enzymes are increased, your drug metabolism is also increased. So, say for example, my drug was going to stay in my system for 6 hours considering my normal metabolism, but now because of the enzyme induction, instead of staying for 6 hours, the drug is being metabolized rapidly. So, within 3 hours my enzymes are enough. So, what happens is, say for example, initially you just had 100 enzymes metabolizing your 100 milligram of drug, and this took about 6 hours process. Now, what happens is, because enzyme induction has happened, imagine instead of 100, your 1000 enzymes have been induced. Now, what happens as a result? This 100 milligram of drug is no longer fit to sustain 6 hours. It might get digested in as early as 2 hours. So, what happens is, the effect of the drug will be very short lasting, and as a result I will need to re-administer the drug again and again. So, enzyme induction is a process of increasing metabolic enzymes, and that leads to decrease in metabolic, or that leads to decrease in pharmacological effect of a drug and rapid elimination of the drug. Now, opposite to that is enzyme inhibition. Enzyme inhibition means the enzymes which were metabolizing this drug have been inhibited. So, imagine the same case again, there were 100 enzymes kind of metabolizing 100 drug molecules. Now, my herbal candidate has inhibited these enzymes, or say for example 50% of enzymes are left active, 50% are inhibited or left inactive. Now in that case, for that 50 enzyme molecules to metabolize it will take more time. So what is going to happen here is, initially what took me 6 hours now might take me 12 hours. So what is happening in the process? Because of enzyme inhibition, I am having more of a residence time of drug. If my drug is staying for more longer duration of time, and consider I am taking the next dose of drug. So in that case, what is going to happen is the net overall drug concentration in my bloodstream is going to increase. So one such example is your St. John's wort, which inhibits numerous CYP enzymes or cytochrome based enzymes such as CYP1A2, CYP2C9 and CYP3A4. So these are different metabolic enzymes which are responsible for your degradation or deterioration of the toxins. Now the fourth way in which your pharmacokinetic interactions are observed with herbal drugs is excretion. There are certain drugs which change the rate at which your drugs are excreted. Now a very good example of this is a drug such as dandelion. Now dandelion extract is given as a diuretic. What does that mean? That causes more of your urine formation and your blood will cause more filtration, and as a result you will have more urine output. Now what happens is, because there is more urine output, most of your metal or mineral ions are also lost in your urine. Similarly, in some cases there are transporters which are there in your cell membrane. Now these transporters are responsible for helping your drug molecule get inside the cell as well as helping the drug molecule outside the cell. Now imagine if the transporters are kind of induced, and if these transporters are the ones which are responsible of throwing molecules outside the cell, if my drug molecule shows my activity inside the cell, and if this transporter is kicking all my drug molecules out, what is going to happen is, say for example, this happens in case of P glycoproteins. So P glycoproteins are proteins which are there on membrane which are responsible for removing your toxins out, and imagine it's just throwing your drug molecules out. So what is going to happen? Your molecules will no longer stay inside the cell, and as a result the net pharmacological effect is going to be minimum or absolutely null. So here these are few examples of pharmacokinetic interactions. Now let us go to pharmacodynamic interactions. Pharmacodynamic interactions generally happen when the drug or herb administered is showing same effect or opposite effect to that of the drug administered. Say for example my herb, or say for example my tea. The tea that I take has caffeine and the caffeine is CNS stimulant. Now if I administer another CNS stimulant drug, or what we call it as antidepressant drug. So your caffeine is also causing CNS stimulation, your antidepressants are also causing CNS stimulation. It is going to eventually increase the effect. So imagine your caffeine is going to stimulate your brain, your antidepressants are also going to stimulate your brain. So what is going to happen? The net effect is going to be additive. So we call it as an additive effect. Now this is what is generally denoted as, so it is kind of sum. So caffeine gives you one particular quantum of effect, antidepressants give you one particular quantum of effect, and the net effect is a addition of both. In some cases when you take such kind of drugs, and you will get more than the added response. Now this response is because the mechanism changes. So in that case you are calling it as synergistic effect. So synergistic effect happens when a drug is administered along with the herb, but instead of just giving you mere additive effect, it is giving more than the desired effect. So I would be presuming a effect till here, but I am getting something much more than that, and in that case I will call it as synergistic effect. The third case is where I call it as antagonism. Antagonism is, say for example, caffeine I know is CNS stimulant. And for people, those who don't get sleep, for them there are drugs such as benzodiazepines, or there are drugs which are generally given as sedatives. So say for example, I combine it with sedative. So we know caffeine or tea is generally taken to wake us up if you are feeling sedated, and imagine this patient is taken sedative because he is not getting proper sleep. So imagine this combination, caffeine plus sedative. What is going to happen? One is a CNS stimulant, other is CNS depressant. So they are going to show opposite effects. So I put it as 1, this is +1, -1. So net effect is either going to be nullified, or depending upon who is more stronger or whose dose is more stronger, either it's going to go on the positive side or it's going to go on the negative side. In that case, we call it as antagonism. The next example is potentiation. Now potentiation is, say for example, you are taking a drug, say for example antidepressant, okay, and this drug is having an effect of 1. Now you take or administer some herb like tulsi or something which doesn't have, or which is not reported to have any CNS stimulant effect. But you are observing that whenever I take this antidepressant and combine it with tulsi or any other herb, I am still getting, I am just writing 0 because tulsi per se doesn't have any CNS stimulant effect. Still I am getting an effect which is much more than this. Definitely there would be a mechanism, but since tulsi is not a CNS stimulant, tulsi is sent to potentiate the effect of drug A. So in that case you will see potentiation. The last example in this category is adverse reaction. Many a times when two drugs interact, normally the adverse effects of the drugs are minimal, but due to interactions the adverse effects are made severe and they are more perceivable. That means they are more likely to be observed or seen. So in that case we have to keep a close monitoring of adverse reactions that we observe. So this might include just like skin irritation, rashes. Normally with drugs you don't get, but if you take a drug and if you take another herb, and after this, because of this combination, you might get some skin irritation, skin allergies or some toxicities, that is classified as adverse effect. So these are all pharmacodynamic type of interactions. Now let's go to study what are called as a little different or subcategories of this, which are called as protein binding interactions. Now protein binding is very vital. Like I said, you might have drug which once get absorbed, you will see bind to proteins. We just had example of drug which showed 90% protein binding and can be displaced easily. So this protein interactions or protein binding interactions are observed. The reason being, most of the receptors in our body which show the pharmacological effect are mostly proteinaceous in nature. So drugs are definitely designed to bind to the proteins. So say for example, this protein binding interactions, once the drug is absorbed, can happen by the proteins present in blood. Now this include your plasma proteins. Say for example, if you are talking about plasma proteins, albumin is the one which shows maximum binding. This is followed by alpha 1 acid protein, followed by lipoproteins, and the globulins is the least interacting or least bound one. Not only that, in your blood there are certain drugs such as metformin which is reported to bind to your blood cells and get absorbed through its membrane. Not only that, your drugs also bind to the proteins or receptors which are present on the cell surfaces. Your drugs bind to the proteinaceous substances which are there in the lipid part or the lipophilic part, or what are called as close to the adipocytes. Not only that, this binding interactions are found to alter the absorption of certain drugs or certain minerals in your bones. Not only that, protein binding interactions, if chiefly, now this is not the last category, this is in fact a most important category. These interactions have been found to even be associated with cytochromes, which are kind of enzymes or drug metabolizing enzymes found in your liver as well as small intestine. So what are this kind of interactions? So CYP450 are actually what are called as heme thioglycolate proteins, or basically enzymes, which are present in the liver, small intestine and little quantities in other organs as well. And like I said, what happens is it acquires, their microenzymes which acquire their name 450 for the reason that this is a heme molecule. So you can see, it has a typically heme structure, and in that heme structure there is a iron moiety. Now this iron moiety is kind of associated with the oxygen, and this oxygen is the one which is responsible for the catalytic activity. Now this catalytic activity, it is seen that this heme, when it is in interaction with carbon monoxide, gives you a very strong UV maxima at 450 nanometers, and that was one of the bases which was used for identification of this enzyme, and hence it gets its name as CYP450, that is 450 nanometers. Now this is responsible for metabolism of endogenous substances, normally xenobiotics, which are outside substances which includes the drug and are also part of hormonal synthesis. Now CYP450 play a major role in your biotransformation. So biotransformation is a way that our body does to get rid of the molecules, which is divided into two phases. Phase 1, we call it as functionalization, and phase 2 we call it as conjugation. So here our CYP are involved in functionalization. Now why this functionalization is necessary? Say for example, you are consuming something which is very lipophilic. Now what is going to happen in the process is this lipophilic drug, in order to get excreted through the urine, has to be converted into water soluble or more polar metabolites. So our body, especially the cytochrome enzymes, add a very polar functionalities to it. Now this transformation reactions include, simple hydroxylation to make it polar, and subsequently dealkylation. So if there is any alkyl group on that, you can have a N-dealkylation, O-dealkylation, S-dealkylation, or even dehydrogenation. Now this also includes your carbon-carbon bond breakup, as well as sulf-oxidation, epoxidation, N-oxidation, as well as even CC bond linkages if required. So this phase 1 functionalization is carried out by CYP enzymes. Now because numerous drugs get metabolized by CYP enzymes, what happens is, if there are enzyme inducers, the enzyme inducers will increase the enzyme concentration. And what will happen? If the enzyme concentration is increased, we just saw, the drug will get metabolized fast. Similarly, if there are enzyme inhibitors, again we saw that, especially CYP inhibitors. Now CYP inhibitors, what will normally, they help us in detoxification of drug. So if this CYP itself are inhibited, CYP will not show their action, and if they will not show their action, these drugs are not going to get metabolized. That means they will stay in our system for longer duration of time, will not get eliminated, and as a result the pharmacological effect of this drug will increase. But when you consume the next dose, it will lead to accumulation and overall toxicity. So CYP interactions are generally classified into following types. So if it is mostly enzyme inhibition, the inhibition can be classified into 3 classes. So CYP inhibition can be what is called as competitive. So competitive means if this is the place where your drug fits in, and this is the place where it, after fitting in, it's going to get metabolized. Suppose if your herbal molecule goes and sit here, that is your phytoconstituent goes and sit here, my enzyme cannot inhibit my drug because it's also sitting at the same place. So this site is kind of blocked to it, and that is why it is called as competitive, because there is a competition between the phytochemical, that is the herb molecule, as well as the drug molecule for the site on the enzyme. The second one is non-competitive. So say for example, here what is going to happen is, again I have my sip, again I have a site. Now this site remains for the drug, but what happens is there is an additional site, we call it as allosteric site. Now what does this allosteric site do? This allosteric site, your herbal molecule or your phytochemical will bind here and cause change in the conformation. Now because it changes the conformation, my drug molecule can no longer fit in, and that's the reason it's called it as non-competitive, because there is no competition. Herb molecule has an entirely different site, but my drug molecule is not able to fit in. The third category is what is called as uncompetitive. The uncompetitive complex is, now enzymes are meant to be recycled, so reused after the transformation is over. But what if this phytoconstituent makes this drug fit in permanently inside it? So it forms what is called as herb, drug and enzyme. So we call it as herb plus drug plus enzyme. This is a ternary complex, and this ternary complex cannot be resolved or dissociated, and in that case there is what is called as uncompetitive. So when my next drug molecule comes in, absolutely there is no site for it to bind it because the complex is already saturated. So these are the three ways in which the CYP enzymes are inhibited. Now enzyme induction or more production of enzymes definitely leads to the rapid elimination of drugs. Now another important protein we should consider is what is called as P-glycoproteins. So I said P-glycoprotein is a vital detoxification protein which is located on the membrane of the cell. Now it's actually a membrane transporter in a good sense. So whenever there are foreign molecules and my cell doesn't like it, so what is going to happen is this P-glycoprotein is located everywhere, intestine, liver, blood-brain barrier, and what happens is if anything is gone into your past your blood-brain barrier, or if anything is gone to your liver, so in that case what is going to happen is you want to detoxify it, you want to remove it outside your brain. So this P-glycoprotein, say right now, is focused inside, will search or scavenge these molecules and bind to it. Now once when the drug molecule binds to it, it kind of flips. So this inside now goes to outside via different mechanism which is powered by ATP. So it requires ATP for its function. So when this happens, eventually it kind of opens up and flips, and what happens is your drug is thrown out. Now imagine this is an advantage when there is a foreign body or foreign molecule in my brain because I don't want it. But imagine when you are talking about cancer therapies, what happens is your cancer drugs are all there inside the cell trying to kill it. But this P-glycoprotein is trying to get rid of it. So it's going to throw all your chemotherapy drugs outside the cell, and your chemotherapy is going to be ineffective. So P-glycoproteins play a very vital role in protection, especially of the blood-brain barrier as well as cells. But in what happens is cancer cells, there is overexpression. So more of this P-glycoproteins are there. So more of this anti-cancer molecules will be thrown outside the cell, and as a result the effect of your chemotherapy decreases, and we call it as chemotherapeutic resistance which happens. So you can check different type of interactions via certain portals. So now that you are conscious that herbs can cause interaction, they can affect my metabolism, let's see where all we can observe it. So I have given you few sites which you can check your interaction. So just let us see them. Say for example, you have Medscape, okay, that's one. Drugs Bank, that's another. So let's first start with drugs bank. So here what you have to do is just search whichever herb you are co-administering. So say for example I am typing here ephedra and I hit on search. So it will give you with some search results, and as a result you can see I am just clicking this ephedra seneca root, and you can have a drugs bank ID, and you can see the therapeutic categories here, that is alpha and beta adrenergic agonist, sympathomimetic, mechanism of action, how it works. Mostly it is a negative modulator, and then you can see here the pharmacology, the pharmacodynamics, and then below that you will see where all it shows its interaction. So these are the different receptors or transporters. In the mechanistic way it will show whether it positively or negatively kind of interacts with the receptors. So you can observe its mechanism, you can see where all, and imagine if your drug also works via the same receptor or transporters, we know that it is going to interact. Not only that, we can try it here also, that is the drugs.com. So we are taking ephedra. So it is saying that there are 208 medications that might interact with ephedra. These are like the major ones, moderate and the minor interaction. So you can see the intensity, and based on that it has listed the different drugs with the intensity. So you can see alphabetically the different drugs, and the extent of their interaction or intensity of the interaction is also specified. So all these 208 drugs have been specified here, and major interactions are observed in case of CVS disease, blood pressure, diabetes and glaucoma. Now moving on to the next site, here you know where your drug is and what herb you are taking. So say for example I am talking about ephedra. So it does not have ephedra, so let us say in that case we will put ephedrine, the active molecule present in ephedra, and we will check its interaction with some other drugs. Now this other drugs, let me put phenytoin. So it is saying no interactions are there, so safe to take. I am talking about cardiac drugs such as propranolol. So yes, they are showing interactions. Now what does this mean? Decreases the effect of ephedrine, it also gives you the mechanism by pharmacodynamic antagonism. So you are going to anticipate an reverse effect, and this also causes a decrease in serum potassium levels. So this is how you can check the different interactions that you know that your herbs are going to interact. In addition to that, if you want to read a few more notes about it, these are few references, and thank you everyone for your patient listening. Thank you.